All right. So mental health services are important. Now, for some people, it's kind of like taboo. Even for me growing up, my culture, we don't always go see a therapist. We sit and we think to ourselves, well, what I'm sit on your couch and tell you my business for? You can't help me. They don't understand the different levels of services that can be provided to them. I didn't. When I was a social services practitioner, I was doing that job, and one of the main parts of my job was to try to enroll my families, the parents, and the children in the therapy. And I'm telling them about therapy, but inside I didn't have anybody in on no therapy. And guess what? My background is mental health. How ironic is that? And I'm sitting there doing that job, and because I've been so resilient, and because I've been so strong, and because I've been an overcomer all my life, I didn't feel like I needed therapy. I didn't think that worked. But that's my background that I'm going to school for, right? So it wasn't until I went back to Houston, about 20 years later after being gone, and I drove past the house in the neighborhood that I used to live in. I couldn't even look at the house. I couldn't even look. When I got home from Houston, I had a panic attack in my sleep. My heart was racing like I was on a treadmill. I got up the next day, I went to urgent care. And the doctor was asking me, do I take any kind of drugs or anything like that? I'm like, I can't just have a panic attack, But, that's how fast my heart had been beating. And it was at that moment that I realized that I needed that mental health intervention. It was at that moment that I realized that I was not okay.